I first want to maybe raise a couple of the highlights of some things we've heard over the last few days as general points. First of all, I want to stick with the idea of audacity, because I think, those of us in the forum really struggle with how to make some things happen in a timely way, or where do we best put our energy and resources? How do we establish work to encourage the most effective partnerships between research and service and so on, in order to bring about change as rapidly as we can, progress as rapidly as we can. And unfortunately, the policy opportunities are happening all the time. I'm sure we have a couple of mental health bills right now, one in the House, one's going to be introduced in the Senate in May. May is Mental Health Awareness Month. So, in some ways we're on an annual cycle when the policymakers' attention to mental health issues, barring a crisis, we're on the beginning of almost a new annual cycle after this May, when people really pay attention to what we have to say. So we need to move as quickly as we can. And I'm struck with the conflict between the challenge Neil gave us yesterday about transformational rather than incremental change. And that is just daunting. As audacious as we want to be, it's very daunting. And I keep finding myself going back and forth thinking, well, we still have to make some incremental changes to make transformational change. And maybe that brings up some of what we've talked about in a number of places today, about the importance of framing and the importance of moving public will, because that's where both the incremental and the transformational change are going to come from. Policymakers in particular are people, and they read the paper. They get a lot of their science information from the paper or the news, so we have to pay really careful attention all the way along, not as an afterthought, but all the way along, about how we're sharing information and how we're moving forward our priorities into communities and into other stakeholder groups. And there's some obviously great communication science out there which we can make use of. There's some other research tools like behavioral economics, which can maybe tell a compelling story. There's cost issues and savings issues and so on. But passive dissemination, or just speaking to ourselves, as Felicia mentioned yesterday, and publishing in our scientific journals, is not going to move anything, because people don't go to look for information. We have to push it out, and we actually have to engage them in how to push it out. So I think that in some ways that's one of our most pressing needs, is to make sure that everything we're working on is actually having an impact and affecting things before we miss cycle after cycle of opportunity. Obviously, I'm focusing on public policy here, but I think that that's part of where we need to be. We keep talking about integration. I've been very struck by the parallels between the different kinds of integration we talked about yesterday, of integrating behavioral health into healthcare, but also integrating healthcare into communities, and integrating social services and healthcare, and integrating the social determinants of health and behavioral determinants of health. And I'm also then struck today, we're talking about integrating in terms of services and research agendas, integrating with collaborators here and different professional groups and other stakeholder groups, family groups, so that we can all work together. And it seems like we've come full circle, and we're in a place where this level of integration and interprofessional competencies and is sort of an advance over where we were when we started to think about interdisciplinary work being so important. Well, we're way past that, and that's going to take some new kinds of infrastructure to be really integrated even among ourselves. So integration seems to be a major theme. There's some very specific things that I want to mention that have been brought to our attention, and I'm doing this deliberately because they'll end up potentially reaching the workshop summary, and if I don't say them, then they won't make it into that. But there's some specific things that we could all think about individually and collectively. So we have paid some attention to the U.S. Preventive Services Task Force, and if we can get some of these preventive evidence-based prevention programs into that task force, and if there's a sufficient research base for them to reach an A or B rating, they would become part of healthcare at no cost to people. Um, that's an obvious opportunity, and I think there's a lot of work being done to try to partner with research and um, researchers and policymakers to try to make that strategic. There's some other specific things, though. PCORI, to get some of our work into comparative effectiveness research, which was recommended to us on the calls with PCORI, and that's why I'm bringing it up here. The same was mentioned to us by the community guide, by the CDC. So to get some of our topical interest areas where we have a nice research base into some of these big prevention guides will be a very important opportunity. We heard yesterday about maybe moving some of these topics into Healthy People 2030. It's another very specific opportunity that's easy for us to let go by, and I think we should kind of keep it on the table. And then I just want to mention another few very specific things. We've heard before in other workshops, and I think this is true, that the Congressional Budget Office does not score savings right now for prevention, only costs. So that's an important area for advocacy and legislative work. If we're going to really engage policy and make make prevention really happen at a big scale. And then lastly, I'll just raise this. I don't have an opinion about this, but several people have mentioned this to us over past workshops and on our calls, which is, do we need an Office of Children's Health? We have an Office of Adolescent Health and Women's Health and Minority Health, but we don't have an Office of Children's Health. And I don't know if that would be advantageous, but I raise it because it's important to think at that kind of big level.